Good afternoon, everyone. We are just waiting another minute or so as we see more people are joining us, but welcome to our inaugural grantee showcase. So good afternoon again, everyone, and welcome to our inaugural Urban Health Institute Baltimore Grantee Showcase. I am Dr. Tangela Purnell, and I'm one of the Associate Directors of the Urban Health Institute. My colleague, Dr. Kelly Bauer, who is also an Associate Director of UHI, and I would like to welcome each of you to our inaugural Grantee Showcase. We also want to thank everyone who has helped to make this event possible, in particular, Imani West, Natalie Wiggins, and Nancy Edwards Molello. Now Kelly will share our showcase housekeeping information and acknowledgements.
Thank you, Tangela. Good afternoon. We have just a little housekeeping. First, our presentation is being recorded and will be shared later. We do invite audience members to enter any questions that they might have at any point during the presentation. You can do that using the Q&A box that you can find at the bottom of your Zoom screen. Questions will be answered live or with a short typed response. In addition, if you see a question that you like, you can always use the thumbs up button, and that will bring the most popular questions to the top of the Q&A window, so we're sure to see them and respond. And finally, this presentation will use closed captions, so you'll be able to read live captions throughout the presentation. We also invite you to stay connected today and share with others about the showcase using social media like Facebook, Twitter, and Instagram. You can see the Urban Health Institute accounts here. We'd love for you to tag us in any of your social media posts and also use the hashtag UHI Grantee Showcase. And before starting the program, we would like to take a moment to acknowledge Indigenous and racial inequities. We acknowledge that the Johns Hopkins University and our schools are on the traditional and contemporary lands of Indigenous peoples. Our campus is on unceded lands of the Piscataway and Susquehanna people. Today, there are more than 7,000 Indigenous peoples in Baltimore City, including members of the Piscataway, Lumbee, and the Eastern Band Cherokee. We acknowledge the history of oppression and systemic inequities while representing all tribal nation sovereignty. We strive to do our own work to address the inequities and disparities that Black, Latinx, Indigenous, and Native persons, Asian Americans and Pacific Islanders, other persons of colors, member of religious minorities, LGBTQIA persons, persons with disabilities, and persons otherwise adversely affected by persistent poverty or inequality experience, while expanding partnerships and following the lead of these communities.
Wonderful. Thank you so much, Kelly. And so as you all can see on this slide, we have an exciting agenda for you today. We will have an awesome video, and I know it's awesome because I both watched it and I was in it. So of course it's awesome. And that's a joke, by the way, and have 2 live panel discussions to highlight some amazing community university partnerships that have been supported by the Urban Health Institute, Baltimore Health Equity Impact Grants, formerly known as our Small Grants Program, our COVID-19 Small Grants Initiative, and our Strategic Consultation Grants. We'll hear from some of the grant recipients about how they were able to advance health equity through their partnerships, and we will learn from them about how to make a community university partnership successful. We'll also have an opportunity for the audience, for you, to ask questions, and we'll wrap up by sharing with you some exciting new UHI initiatives and events. Now, at this time, I would like to welcome Dr. Lisa Cooper, the director of the Urban Health Institute, who will give us a few opening remarks for today's event.
Okay, thank you. It just took a couple of minutes for our co-host to unmute me. Good afternoon, everyone. Thank you, Kelly and Tangela. My name is Dr. Lisa Cooper, and I am just pleased to be with you all here today. The mission of the Urban Health Institute, as many of you may have heard, is to advance health and health equity in Baltimore. Tangela and Kelly have done a wonderful job of leading key initiatives to support this mission by facilitating and recognizing collaborations between communities, universities, healthcare delivery systems, government, and the private sector to build collective capacity for achieving health equity in Baltimore. Next slide, please. So the Baltimore Health Equity Impact Grants, the COVID-19 Small Grants, and the Strategic Consultation Grants provide our faculty, students, and community partners with exciting opportunities for collaboration. They also provide an opportunity for mutual learning and capacity building. We have so many outstanding community-based organizations and governmental agencies in Baltimore that are already promoting health and health equity. But with these grant programs, the Urban Health Institute is able to support organizations and agencies to further advance their missions through partnerships with faculty and students who are able to offer innovative research approaches and technical program support. Over the past 13 years, the Urban Health Institute has funded 176 grants. This is a total investment into the Baltimore community of $1.36 million since 2007 when the grants program was established. And now I'd like to introduce Reverend Deborah Hickman, who is CEO of Sisters Together and Reaching, and the community co-chair of the UHI Community University Coordinating Council. So we're just waiting for Reverend Hickman to join us on camera.
Thank you very much, Dr. Cooper. I am very, very pleased to be here today as a lifelong Baltimore City resident and as co-chair of the Urban Health Institute Community University Coordinating Council. The CUCC provides guidance to the UHI by ensuring that the priorities of the UHI are in line with those of the university and, most importantly, the community. The CUCC membership is evenly divided between university and community representatives, and co-chair leadership is a shared representation of a community and a university member. We know that here in Baltimore, we have long-standing health disparities that negatively impact many of our neighborhoods. including right here in East Baltimore, where Johns Hopkins is located. The only way that we will make real progress in addressing these issues is by investing in true university and community partnerships to really tackle these problems in a very meaningful way. Today, we celebrate several outstanding university community partnerships and look forward to hearing best practices from participants. Finally, I would like to leave you with a scripture about the importance of this work. Galatians 6 verse 9 tells us, "And let us not be weary in well-doing, for in due season we shall reap if we do not faint." Let us continue to do good work on behalf of the communities we serve. Thank you very much. Have a blessed and wonderful week.
Well, there's nothing left to say to that except amen.
Amen.
Now we are thrilled to share a short video, as I promised, that will feature 3 of our academic community partnerships and highlights the impact such partnerships have made in Baltimore and beyond. And so I welcome Natalie and ask her to play the video at this time.
At the Urban Health Institute, we work across Johns Hopkins University to advance health and health equity in Baltimore via a wide range of programs, events, and educational and funding opportunities. So far, we've funded projects and programs doing amazing community work throughout the city of Baltimore. Community academic partnerships offer unique opportunities to draw from the respective strengths and expertise of academic institutions and community members. We are thrilled to support initiatives that enhance the well-being of our communities and create a more equitable Baltimore.
3 of our key initiatives include the Baltimore Health Equity Impact Grants, which have been funded for over a decade now, our strategic consultation grants, and most recently, our COVID-19 grant initiative. So our COVID-19 grant initiative was really funded around the central idea that we know that COVID-19 has disproportionately impacted the health of many of our residents here in the city. And so this is an area of high interest if we want to advance health equity.
Yeah, when the pandemic hit, I was particularly frustrated with federal response. There was a lack of communication, a lack of awareness of what needed to be done as far as like getting masks out to people. And I'm thinking about particularly in my community, there are a lot of people who are low income, a lot of elderly people in my community as well, who needed masks. And I knew that there were lots of amazing organizations that could support us with getting the mask out to our community. One of the organizations in the Greenmount West neighborhood is called Station North 2 Library, and they have a team of sewists. So they made over 1,000 masks. I'm really appreciative for all the love that we're getting around our project. It just shows that we're actually doing something to make a positive change in our community.
For the Baltimore Health Equity Impact Grants, we're really looking for strong partnerships, innovative approaches to addressing health equity and improving the care of Baltimore residents across the lifespan and in spaces where perhaps we aren't typically providing health and healthcare services.
In a city like Baltimore, you see so much trauma, so many experiences that parents go through are going to shape the way that they experience their life and the way that they parent their children. So a program like the Chicago Parent Program is a great way to just give parents a support base and allow them to connect with other parents in their school community.
You can't do much to help children unless you also help their parents, because at the end of the day, children go home. There really weren't any good evidence-based programs for addressing the needs of families raising young children in low-income and underserved communities, and they needed that. Being able to give them a different outlook and different strategies to communicate with their child, that's what the program is all about. It's been absolutely amazing. Families get so much out of it, and 87% of parents said that they were much more likely to participate in future programming. Both students and parents feel nurtured, and schools are allowed to play an important part. They're allowed into the family. And we want the home to be a safe, nurturing, responsive place for kids. But you can't do that unless you also support the parents.
The Urban Health Institute is really working to connect community and community organizations to the faculty, student, and other resources that we have here at Hopkins to really amplify the work of community organizations and to center their needs and voice.
It's So the Emotional Emancipation Arts Initiative was done by Woundward Productions, and it utilized theater, cultural practices, various forms of performing arts to create a culturally relevant space for Black people to talk about the trauma associated with racism in the United States.
So it was a way of developing strategies to extinguish the lies of white supremacy and Black inferiority once and for all.
We do it with the performing arts. Arts and culture is a modality by which people can be healed.
Then each company group created a theatrical piece that related to the issues of racism. And I think that was very powerful.
You know, it's an opportunity to show that creativity, that imagination, that the things that make us human can be part of the solution.
It is so important to have faith-based leaders involved because we know that they are already trusted agents in the community and already have very important community level ties that we need.
FAITH is an acronym that stands for Fostering African American Improvement in Total Health, and it is a cardiovascular health and wellness program that integrates community-based interventions to promote heart health. So racial and ethnic minority groups are disproportionately affected by chronic diseases such as, heart disease, hypertension, diabetes. And we wanted to come up with a community-based strategy to overcome these disparities. And we decided that what's the trusted institution within the Black community, the Black church?
This program, they knew was definitely going to work if they just had a shot to present to some people. And as a church, that's our responsibility. People were talking on Sundays about reading labels. That's why I remember it so well.
We also wanted to learn from them about what was important. It's not, we can't just come in and say, do this and that. We need to understand where they were and what health challenges they're facing.
We have now over a decade of experience, and we've continued to grow. If we really want to achieve health equity, we have to meet people where they are.
Our strategic consultation grants are a really unique opportunity by supporting faculty members who are working directly with members of the Baltimore City government. For example, are there neighborhoods that are being disproportionately impacted by health inequities?
Baltimore is one of them. The cities which have a lot of problems with vacancies, and that includes vacant as well as abandoned lots. This is a major problem. Estimate is 14,000 or more abandoned lots. In consultation with the city, we selected 100 such plots. Asking is what is the quality, soil quality specifically. Using this information, they can have a better management plan as well as they convert those vacant lots into green spaces. Is also it benefits the city as well as the residents.
We know that the fight for health equity in Baltimore is far from over, but knowing that our grantees are front and center in this effort and seeing some of their results, we feel confident in our efforts and look forward to what is to come. Personally, I want to thank everyone involved in today's program, as well as others we didn't hear from, but we know are working hard to advance health equity in our community. Reverend Martin Luther King once said, "All labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence." UHI looks forward to supporting such labor with you. And today you saw a snapshot of that excellence. So thank you.
That was it, as I promised. Wasn't it an awesome, amazing, excellent video? So at this time, while we are actually inviting our panelists for our faith-based partnerships discussion to join us in getting everyone set up with the spotlight, I want to give an acknowledgement to the participants in the video who are not speaking today, but that I see in the audience. I know I saw Dr. David Fakunle, I saw Dr. LaPrincess Brewer, anyone who was featured in the video and is not speaking today. Would you mind using the raise your hand feature if that's available? And we can at least acknowledge and thank you all for the hard work. Okay, I see multiple ones. Oh, there's a lot of people here. So thank you all. You all can see that this is a community effort and we all are very grateful for the hard work of everyone. Thank you all so much. And let's add some comments to the chat. What did you think of that video? And we'll get back to some of those shortly. So at this time, I would like to welcome several panelists for faith-based discussion. So Dr. Raquel Greer and Pastor Marshall Prentice, who will be talking to us about their grant, Power to Control Diabetes, implementation of a community-based diabetes self-management program in East Baltimore, as well as Pastor Michael Addison and Pastor Phyllis Addison, who will be sharing with us about a grant that they are partnering on with me called Partnering with African American Faith Leaders to assess COVID-19 concerns and to develop a novel educational curriculum. And so I think we can stop sharing the slides and get ready for our discussion. All right, well, I am so excited, as you all know. This is our faith-based partnership grant. So this involves our pastors and I love it. Let's start by, I would like to invite all of you to introduce yourselves briefly. And we'll start with you, Dr. Greer and Pastor Prentice, followed by Pastors Michael and Phyllis Addison. So if you don't mind unmuting and telling us a little bit about yourselves.
Good afternoon, everyone. I'm Raquel Greer. I am a primary care clinician, and I also serve as the education director for the Johns Hopkins Bronchitis Center for the Advancement of Community Care. The mission of the Bronchitis Center is to improve the health of communities with and in partnership with the communities. And we approach this by implementing programs that are health-focused, evidence-based, outcome-driven, and sustainable in community-based settings. And we were really excited to partner with Pastor Prentice at Zion Baptist Church to apply for and receive an Urban Health Institute grant back in 2019 to implement community-based diabetes self-care management programs.
Good morning, everyone. To God be the glory. Thank you, Dr. Purnell. Good morning, Dr. Addison and Dr. Greer. So wonderful. My name is Marshall Prentice. I serve as the servant leader in Zion Baptist Church on Carolina and Danville Street, Northeast Baltimore. And we've been working with Johns Hopkins for many, many years. And we have a great relationship also continuing with Dr. Raquel and the people of the Bronchitis Center, and some great work that we're doing around diabetes. Thank you.
Awesome, welcome.
My name is Michael Addison, and this is my wife, Phyllis Addison. I serve as a senior pastor, and my wife serves as a pastor of the New Life Restoration Ministry. At the moment, we are a very new ministry that has just begun. Most of our worship services is done on virtual. And Dr. Purnell has came to us with a collaboration to be part of the COVID-19 small grant that we're partnering with African American faith leaders to assess COVID-19 concerns and to develop novel educational curriculum. Thank you.
Wonderful. And this time we're gonna stick with you both, Pastor Mike and Pastor Phil, which is what you have generously allowed us to call you at church. So let's start with telling the audience a little bit about how the relationship started. So how did we first meet each other?
Well, good evening, everyone.
Good evening.
We first met at the Friendship Baptist Church, where we were former members under the leadership of Dr. Alvin Gwynn Sr. And we have known each other for over 8 years now. We had an opportunity to meet in church, actually praying for a young lady whom God actually healed. And so it developed a relationship between the three of us, actually, four of us, actually. We've grown together in prayer. God has done some amazing things in our life. Dr. Purnell was a part of the Master Life Bible study, and her husband, Dee, was a part of the regular Bible study. And it was Michael and I who were teaching at Wednesday night Bible study. And we sort of just joined together, just glued together. And now we are pastors at the New Life Restoration Ministries, where Tangela and her husband has joined in with us. So we're grateful and thankful that they're there.
Just to add to that, both of them, Dr. Parnell and husband Dolan, they have a personality that draws you to them.
Yes.
So that the magnitude of our relationship grew just from seeing the love that they had, yes, not only for one another, but the love they had for God and for their church.
Man, that was so nice and so wonderful. I don't know, Dr. Greer, Pastor Prentice, can you beat that story? How did you how did you first meet? Like, how did you come together around this opportunity?
I'll let Dr. Greer go first.
So I think, we had originally met Pastor Prentice probably in 2015, I believe. So almost 6 years ago, where, we had the Bronchitis Center was recently established, and we were working to establish community partnerships. And our former research director at the Bronchitis Center, Diane Becker, actually put us in touch with Pastor Prentice based on a prior initiative that they had together. And our first meeting was really just understanding what Pastor Prentice felt that the health needs were of his congregation and his community, and working together to find avenues where our expertise and his goals aligned. And that really centered on diabetes initially. But Pastor Prentice, I'll let you tell more about those initial meetings.
Well, like you said, the exciting thing is, excuse me, we learned that relationships flows through power, and power flows through relationship. And having a relationship with Dr. Diane Becker, and we did some winnable things under Heart, Body, and Soul. And when she introduced us to the staff of the Bronchitis Center, we met Dr. Raquel. There was just a great relationship right then and there, her and Dr. Nisa. And when we agreed that we needed to do some things around pre-diabetics and how we can do some things that could help our community that were winnable around prevention. And the way they came in and shared with us, the partnership was really a partnership based on us listening to each other, respecting each other in terms of our professionalism, and the courtesy of that, of welcoming both institutions, the faith institution of the church and the Johns Hopkins Bronchitis Center. And in that relationship, after sharing with them and learning the process and giving a training, the excitement around that was initiating something that we did for a year that was so successful in terms of treating those who are pre-diabetic, and to see the winnables and the excitement, and also the existence of a relationship that was permitting us to work together, serve together, and not just see each other in our professional work, but as a commitment for bringing healing to the community. And she's just a lovely person to work with. And I have to say it this way, and I say it in love, that we're all working together, but when we can see one another that looks like us too, that's very important.
Absolutely. And it sounds like, from what I'm hearing, it sounds like the existing relationship and some of the existing initiatives and priorities are also perhaps where the idea for your UHI grant came from. Is that correct?
Yes. And so we had our initial initiative that we partnered with Pastor Prentice around was the diabetes prevention program. And that was led by Nisa Maruther. And we partnered with Pastor Prentice and several amazing people within his church, including, and I just have to name them because they're so amazing, Melvin Jones, Sonia Hall, and Tanya Jackson, who helped deliver that really successful program. And it was so successful, we were recognized as the first, we were the first CDC recognized diabetes prevention program in Baltimore City based on that, how successful that program was. And in implementing that program, what we heard, it was targeted towards pre-diabetes. And so we heard from members of the congregation and from the community, and so it's like, what about the people with diabetes? What are you doing for us? And I think, we heard that call and we worked to try. We're like, we have a program in mind. Felicia Hilbriggs has developed an amazing Decide program, which is really targeted at improving how patients manage their people manage their diabetes in the context of their everyday lives. We have that program in mind. We just need funding, and the Urban Health Institute was that funding mechanism that we identified, and we worked with Pastor Prentice to secure that. And we're amazing to have had the opportunity to implement it and to keep implementing it at Zion Baptist Church and in more churches in Baltimore City.
Wonderful. And as the audience heard us mention earlier, so Pastor Michael Addison and Pastor Phyllis Addison and I collaborated on a grant focused on COVID-19. And so I'll share a little bit about my perspective of where I believe the idea also came from. And then I will invite them to also share why they trusted me and why did we decide to sort of go after this initiative. So as you all know, COVID-19 has disproportionately impacted the African-American Black community at a rate that, really none of us could have predicted based upon where we were even 18 months ago. One of the things that really kept me up at night was learning about some of these quote hot spots sort of happening as people were coming together around attending funerals and around, just trying to continue to be a part of worship services, knowing that in some ways, before we really knew exactly all of the different ways that the virus was being transmitted, when we started getting those reports about, entire groups of people who had passed away, and you found out that they were sort of getting it from those in their close social networks, that kept me up at night, to be quite frank. But then I was inspired by the fact that Pastor Mike and Pastor Phil, who were already leading, and I don't believe we've mentioned this yet, they also lead a group called the Married Mates Ministry, which involves about 250 faith leaders and congregation members across multiple churches in the city. They already had these weekly Bible study groups, and they were meeting in person. But at the beginning of COVID, they really started to just create a whole new system of providing this service on an online platform so that people could still worship together in a safe way. And then that evolved into a full-blown Sunday worship service, which is also happening now, and I believe involves probably about 10 other associate ministers and other faith leaders. And so at that time, I thought, we know what a trusted agent our faith leaders are in the community. And these are people who are just doing it well and doing it on their own dime. And I just thought it would be so wonderful if we could partner together to both further assess some of the educational needs and tangible needs of the congregation members, but also to share best practices with other faith leaders. And so I'll invite the two of you to correct what I got wrong or to add your own thoughts.
One of the things, and we thank you, Dr. Perna, one of the things about the partnership with UHI, I remember that when you presented it to us, one of the things you said that it was by God. And so one of the things that the board was effective for us was we realized that this was not by human effort to establish this connection. It was only by divine intervention. And we were so grateful that you chose our ministry or us to be part of UHI to bring forth this grant so that others may benefit from it. One of the things that I also admire about you is that we were able to converse with you about the various things that was going on, and you had compassion, as you stated, for people of color. And your whole objective was to make them aware of what was going on, the availabilities of some of the concerns that we had concerning COVID, as far as vaccine, as far as some of the side effects, should we take the vaccine or things of that nature. So, and then you use your expertise, and I can't pronounce it, is it epidemiologist? You use your expertise as an epidemiologist to share with us, which really was great, because that takes us to the next part. That's one of the reasons why we could put our trust in you, because you had the knowledge of the various diseases and the various effects, how the disease occurred in the body.
Wonderful.
And of course, Dr. Purnell, she was always there for us. The important thing for people who are hurting during this COVID season was, is there somebody there that could help me in this situation? And many times what we allowed to happen was, during our services, we would take the time out, whether it was an announcement that came forth or whether it was on what we call our virtual parking lot. And we took the time out to answer questions like, I have underlying conditions. Should I take the COVID test? And of course, the answer is follow the sciences. People were wondering whether or not, whether they could even, let's see what I want to say here. People were wondering, deaths were in the family. There were a lot of deaths. People were grieving from the deaths, and seeing the things that's happening caused them to be somewhat upset. And of course, since we are the church, that's where they came to for answers. And, God blessed us to have Dr. Purnell there that could soothe the people, that could direct them, and then give them a way out. And that way out was, let's get together and collaborate and come up with a grant that could bless the community. Not only the church, but our focus is not just the church, but we must reach beyond the walls of the church and help our people that are hurting, especially in this COVID season. It's been devastating to many of the people. And so not only was she there in those virtual meetings, but she did write-ups of our sermons on Sunday and put them out on Facebook. She also put attachments to it, and she just does an excellent job. She is our publicity person, and all manner, everything that happens, she's our publicity person. And so we are grateful to have her as part of the congregation and as a very dear friend.
And I want to add another thing I think we shared earlier in the week, Dr. Purnell, is that social media is good, but sometimes social media could be bad, and that people get information and they get wrong information, which causes dissension among the people. So that's one of the benefits that, where we can trust you in, is that you can correct those issues that people assume were right, but you corrected them. So, that was the true access that you brought before, not only the congregation, for those that participate in our virtual services.
Thank you so much. So many key takeaways. We heard here about credibility, about trust, about being there beyond just a particular project, about being available in the ways that your partners or even participants need, as well as being willing to provide correct information, or just to say, I don't know, even if you really don't know. All of these are very important things in terms of thinking about relationships with community partners. In our last 2 minutes, I will start with you, Dr. Greer and Pastor Prentice. Tell us about, some key things that people need to keep in mind when you are partnering in particular with members of the faith community. Any final words of advice for others who might be wanting to apply for one of these types of awards?
I think for me, if I may go, Dr. Greer, first, is to remind us when we use the word partner, that's equal. We're coming together and not assuming that we know everything, but that we, as we've heard Dr. Addison and them say, building that trust. And that's one of the things I love about the relationship we've had with the Bronchitis Center with Dr. Greer, that relationship of trust, accountability, and staying with the encouragement of doing what is necessary because we believe in what we're doing for the best results for everyone. and watching and helping them buy into it. And then we also celebrate with them because we're doing things that are winnable. And then that builds a stronger relationship that the people are saying, what's next? Dr. Greer.
No, and I echo those same comments. And I think part of it is approaching creating these partnerships, recognizing that, you know, our community partners have amazing assets and resources and expertise that we have to learn from. So going in there, looking to learn, understanding what their needs are, and leveraging those assets. I can say that, you know, Pastor Prentice from the get-go wanted to ensure that these programs were sustainable and wanted to ensure that his members of his congregation were trained in implementing these interventions. And so, you know, we've had the amazing opportunity to work with, again, some of the same people, Vanya Jones and Angela Walker, who were willing to take the time to learn how to deliver these interventions. They did it so, you know, they did it so amazingly well. I learned from the skills that they brought to what we were doing. And so, again, I think approaching it from that aspect instead of thinking about what expertise can I give them, sitting back and learning like what expertise and resources and assets can we work together and share in order to, again, improve the health of the community.
Dr. Purnell, if I could just throw one other thing in. A lot of us have health ministry, nurses and ministries in our church, and that gave even more credibility because we were able to utilize them in their profession and then those who had a desire. And so that when we work together, they're the ones helping and guiding. And this partnership gives credibility to that spirit, mind, and body. And as God uses all of us for the healing process. I just had to say that. Thank you.
Final words, Pastor Mike, Pastor Phil.
We must remember that the church is the source of information. Mm-hmm. So we thank God for all of those who speak in its capacity. And, you know, this project was designed to help determine the educational needs of our community. And there are special needs, there are stress factors, there are financial needs. And, you know, our target population is those that are 18 and over. And so the idea is just to be there for the congregation, to work and to help protect our people and to reach a greater number of people.
One of the things is that our hope is and our goal is that the foundation of this partnership becomes a lasting relationship, yes. That it may be for generation after generation, that we have something for them to build upon, and not to become a fly-by-night opportunity to advance personal agendas. Yes. Pastor P made the statement, said that we may go beyond the norm or go beyond the wall. And that's the mandate of our ministry, that we reach beyond the wall. Yes. One of the things about the ministry, although we have maybe about 40 members at the moment, on Zoom, we have people in Iowa, we have people in Florida, yes. We have people what's it? Can't pronounce it. Anyway, we have somebody in the Virgin Islands. Yes. We have somebody in Texas, North Carolina. So we're able to reach a larger masses than we would if we were in a building. So, you know, not to build COVID up, but COVID had a way of scattering the church. Yes. You know, where we weren't able to meet the masses in the building. Now on the virtual platform, we're able to meet areas of assistance and advice that we were not able to meet. Yes. Other than that, outside of the virtual. But also, I just want to say this about Pastor. I said that again. Pastor Prentice called a pastor again. But the reality is, I do want to say this about Dr. Purnell, is that she has been a wheel. She has been the motivating force behind what's going on. Yes. You know, and I enjoy it because she's not giving us any rest. I
like it too.
Do this, you know, and it's good.
Yes.
Because
that's real good.
Is something new for us. And that's one of the things I think that would be that's awesome, that's needed in the partnership. Someone that has the same motivation, someone that's able to motivate you to that same level. Yes. So we give our kudos to you, Dr. Purnell, yes, for who you are and who God has made you to be. Yes. You know, and as a body, as a people, I should say, and as a community, that we'll benefit from the great work that you're doing.
Yes.
And we co-sign on that. I want you to know, Dr. Purnell.
Well, look, Dr. Greer and I don't think we're sleeping either. So, you know, we're going to lead by example. None of us will sleep until we're all well. Well, thank you again to all of our participants on panel 1. We went about 5 minutes over, but that's okay. We got some great comments and some great feedback, and we thank you all. And so I will just end by saying amen. So now at this time, Kelly will introduce our second panel.
Thank you, Tangela, and thank you to all of our panelists. I'm excited to introduce to you our second panel on government partnerships. The panel will include myself, Stacy Tuck from the Baltimore City Health Department, Kathy Slavic from the Department of Earth and Planetary Sciences here at Johns Hopkins. Each of us have been the recipient of either a UHI Strategic Consultation Grant or the Baltimore Community Impact Grant and the COVID Grant. And all of these projects are projects that have been conducted in partnership with Baltimore City government agencies. So we will be asking each of our panelists to introduce themselves when we get started, but I'd like to take a moment first to introduce our moderator, Dr. Vanya Jones. Dr. Jones is an associate professor of the School of Public Health, and she's also an associate director for the Urban Health Institute. Dr. Jones is responsible for the strategic consultation grants for UHI and for mobilizing resources to support promising strategies and promote the health and well-being of Baltimore residents. Thank you so much, Dr. Jones, for moderating this panel this afternoon.
Thank you. Here's the magic of Zoom and unmuting of Zoom. Thank you so much, Dr. Bauer, for that lovely introduction and the discussion that we're going to have continuing on this theme of partnerships and building partnerships and what it means to build partnerships with different groups. I want to start by having the panelists, who are the most experts in themselves, introduce themselves. So can you share your name, your title, your organization, and a little bit about your role in your organization? And so why don't we start with you, Stacy Tuck?
Okay. Hello, everyone. Good afternoon. I'm so excited to be part of this panel today and this wonderful discussion. Boy, the faith-based panel really set it off in such an inspiring way. I'm Stacy Tuck, and I work for the Baltimore City Health Department, and I also represent a collective impact strategy called Be More for Healthy Babies, which has existed since 2009 and has the mission of reducing infant mortality in Baltimore City, also reducing child abuse and neglect, and improving school readiness. It's a life course approach that has over 150 partners, and Hopkins and the Urban Health Institute have been major partners with us in this endeavor, as far as our other key partners, the Family League of Baltimore and Healthcare Access Maryland. But I'm not going to go over all 150 partners because that would take the entire length of our panel. My work specifically as part of the leadership team is helping to oversee the entire BHB strategy, but also I hone in on citywide home visiting and care coordination. And through my work, I've had the pleasure of knowing Dr. Kelly Bauer and working with her on a couple of different Urban Health Institute grants. One, a community advisory board. It allowed us to start a community advisory board. And then the second one was a COVID relief type grant. Thank you again for having me.
Thank you, Stacy. Kelly, would you like to, since I feel like Stacy naturally tossed it over to you, would you like to talk about your role? And
yes, thank you. So my name is Kelly Bauer. I'm an assistant professor at the School of Nursing. I'm a public health nurse, and my research focuses on racial disparities in maternal and child health. And like Stacy mentioned, I've really had the great pleasure of being in partnership with the Baltimore City Health Department and the Be More for Healthy Babies initiative since about 2010, so not long after they started, in both my capacity as a public health nurse and in my capacity as a public health nurse researcher. So we'll be excited to share more about that.
Sorry, again, the magic of Zoom. We're gonna now go to Dr. Kathy Slavic to talk about her role, her project, and her organization, which I think is interesting because I know it's Johns Hopkins. So I'm gonna throw it over to you, Dr. Slavic.
Yes, thank you again for having me. Hello, everyone. I'm Kathy Slavitz. I'm a research professor at the Department of Earth and Planetary Sciences at the Krieger School of Arts and Sciences. And I am an urban ecologist. Specifically, I'm interested in soil health issues. I might be the only one in this group who is not focusing on human health, but I can assure you the two are related. Well, not unrelated anyway. My partner in this project is the City Department of Housing and Community Development, and my research, or our research, is focusing on vacant lots and the condition of newly created vacant lots after homes, row homes, vacant buildings have been demolished.
So can we stay with you, Dr. Slavic, and can you tell me about your project and where the idea of your grant came from?
Yeah, so so I have been studying soils in Baltimore for almost 2 decades. That was mostly part of a larger project, an NSF-funded project, the Baltimore Ecosystem Study. We mostly focused on different kinds of land uses, residential lawns and forests and parks. And we were interested in how human management or how the history of a site affects physical, chemical, and biological properties. We haven't studied vacant lots, so, but as we know, this is a huge issue, vacant homes and vacant lots. And vacant lot soils are very unique because they are essentially what we call engineered soils. These are things that haven't developed naturally. These are soils that people created. And so we were interested in, or we are interested in, knowing how the different contractors, different types of protocols that the contractors follow affect these qualities, these various properties, and using this information, perhaps we can make recommendations on how these newly established green spaces can be put to further use.
Can you give us a little bit of a teaser on what your project was able to accomplish?
We went, so our project was a little bit delayed because of the COVID. Fieldwork was not allowed for a while. So we just started in January. We went out to 100 such plots. And so the partnership comes from consultation by the city government. The city gave us their priorities of neighborhoods and areas and where should go and where we should sample. So we selected these 100 lots and took soil samples, and we're looking for some of the obvious, which is heavy metal contamination issues, but also we want to look at other properties, carbon content and so on. And also we make some observation about, just the general, I guess, appearance of these vacant lots in terms of what kind of plants are there, how they appear to be maintained, are there any trash, and so on. So we collect essentially observational data about this, and then we will provide this back to the city government.
I'm going to shift gears in this talk, and can you answer similar questions? Can you tell us a little bit about where the idea for your UHI grant came from?
Sure. So Dr. Bauer and I worked together for a long time. And so naturally, our partnership kind of evolved from the relationship that we had already had. But our particular focus for starting a community advisory board really grew out of response that we were having internally within Be More for Healthy Babies. And the governance structure of Be More for Healthy Babies had always had just your more traditional host of heavy hitters, large institutions and academic institutions as well. But being that we are a collective impact strategy that is all about serving community and being there for community residents, we realized that we were missing the community's voice in our governance structure. We always had two very strong community collaboratives in two distinct neighborhoods, but what was missing was that overall or overarching community influence on how we made decisions, how we spend our funding, knowing what's important to community. And since 2014, we had been doing some work around really infusing an equity and an anti-racist approach into Be More for Healthy Babies. And so we had been doing a number of trainings with our staff, and just the pivotal key moment that kind of changed everything for us was when we did a training called Undoing Racism, which is an extremely intense 2.5-day training. And all the other trainings we had done kind of just covered things from a historical perspective and more of a surface or a systemic level. It didn't really address interpersonal racism and other factors that might really be going on that are influencing how we set policy and how we did services and programming. But once we had that Undoing Racism training, and we really stared in the face of how much institutional racism has played into our programming and how it was even seeping into how interpersonal racism was seeping into how we were running things. Once that happened, and we also recognized our responsibility as gatekeepers and all of these different power dynamics that were going into things, we were like, we really need to change our governance structure. And we really need to invite the community to the table and give them much more of a voice that was in a larger way than what we had been doing through our two distinct community collaboratives. So we talked about forming a community advisory board, and we talked about how it would be important to have representation from many different parts of the city. And this grant opportunity came along that Kelly introduced us to, that Dr. Bauer introduced us to, and we applied and we were funded for that. And that was several years ago. And we've been able to really use the influence of our very powerful board members that had a very, very diverse set of backgrounds to really help us just to come to reality about some of the things and some of the decisions that we had been making. We're very proud of the board that we were able to build. We had several men as part of the board that were grandfathers and fathers. We've had moms and grandmothers and some professional level folks, some community member folks, some folks that had experienced homelessness and all kinds of things during the course of doing work together. So it was a very powerful, very diverse set of people that have come together to help influence how Be More for Healthy Babies has been running.
I think you tied in your answer to the second part of that question, which is what happened. And, I feel like between both of you, this is such a phenomenal story of great experiences and highlighting what we'd like to see. I'm going to ask Kelly, I'm going to shift gears and ask Kelly just a little different since we're dropping formalities and last names. I'm just going to go with Kelly and ask Kelly really specifically about the relationship between Hopkins and your community partner, Stacy. Can you tell us a little bit about how your grant either promoted or what it looked like to have this work build the relationship between Hopkins and the community?
Yeah, thanks, Vanya. So one thing I would just add to what Stacey said also is that, one of the many exciting things about this is the sustainability of it. And the fact that, this grant offered sort of a seed, an opportunity for BHB to really carry through on what was their vision of, being more accountable to community. And it is now built into their structure, their permanent structure for Be More for Healthy Babies, and making sure that they are really accountable to community even more so than they were prior to this. So that's really exciting. And I think in addition, it has, further deepened the relationship that I have with Stacey and many of her phenomenal colleagues that are all part of Be More for Healthy Babies, and has really opened my eyes to the really depth and breadth of the work that BHB is doing. I've been able to provide student opportunities for students to have practicums and do other work with the health department and the Family League and some of the other BHB partners, which really, I think, expands our students' capacity for working in community after they leave Hopkins. And, again, the sort of continued relationship and thinking about our next grant, which was the COVID grant, and saying, when COVID hit, I was, my first thought was, oh gosh, what's happening with home visiting? What's happening with Be More for Healthy Babies? How are all these services and programs moving to virtual space? And so we were able to put our heads together and say, what are the real needs for home visitors right now and the families that they serve? And how can we best really make sure that that program is able to continue in its most effective way? And so we were able to purchase, get the COVID grant through UHI and purchase video equipment for home visitors and for families to help really make that interactive video conferencing more effective during the COVID pandemic.
Yeah, so I'm going to stay with your project for a minute. I want to turn back to Stacey. You mentioned, the coalition has the powerhouses. And when we talked about this panel, we talked a little bit about why I was interested in this type of mechanism of supporting work between Hopkins and government entities, and how the changes in those entities really impact the city in such a real way. Can you talk about this experience? So you're continued to be able to work with your partner, and what this experience has been able to do in the relationship that is building, partnerships between Hopkins and a government program.
Well, I can say that it's just been very positive, and this grant opportunity, as Kelly had mentioned, just really has deepened in a relationship that had already been established. And it's just been really great to get exposed to other facets of Hopkins. I know that naturally the health department and Hopkins works together a lot anyway, but really this opportunity has helped to kind of solidify some other partnerships that hadn't existed before. And also really just to help us to really, really hone in on the importance of community. And I think we have said during just this panel, between the first panel and this one, I think we've said the word relationship about 100 times probably. And that really is because it's the crux of everything. Hopkins in and of itself is a huge institution. The health department is also a huge institution that's part of an even larger machine of the government. But really what makes things effective and what makes things work are the individual relationships that individuals that are part of those organizations, the relationships that we form together. So I would just say that as a representative of a government agency, it's just most important that we remember community and remember why we're doing the work we're doing, and that any new endeavors that we are embarking on has to take into account the impact that it's going to make on the community, and whether or not this is something that the community actually wants or needs. And that we, as Kelly had mentioned, sustainability, that we think about the ongoing ramifications of whatever we start. My mom always said, finish what you start. So, it's something that helps to build trust, the more we can make things permanent.
Yeah, I think Kathy has an interesting experience with making things permanent and the conversation around, building partnerships. And I want to turn to you, Kathy, because I think your project is a unique one, but one that really amplifies what we're trying to do. So can you talk a little bit about your partnership with the city and how you're, and what are some of the things that you've learned?
Yes, I mean, certainly. So my partnership, first of all, was established with the help of a third person whom I should mention, and his name is Tamás Budavári, and he's an associate professor at the Department of Applied Mathematics. And he had this long, several years going partnership with the Department of Housing, specifically with Michael Braverman, who was the housing commissioner, and they were working together the vacant house problem in terms of demolition, optimizing demolition issues. And so I got to know Michael through Tamás Budavári. And so, which is the second step, once you demolish the home, what's going to happen with that lot. And so we started out talking about this project, and luckily we got funded and we started the work. But in the meantime, Michael Braverman is no longer the housing commissioner. So I think one of the challenges of maintaining this relationship is some kind of permanency, or the fact that there is turnover in the personnel, especially if you're building a person-to-person relationship. There is turnover of personnel in the city government. And for us, on the science point of view, I think the challenge of maintaining a long-term relationship is that grants have a certain lifetime. So you get some funding to do a research for 3 years. Mm-hmm. And if it's that kind of a grant that you actually use the money to do analysis or pay graduate students or something like that, it's very difficult, very challenging to maintain this on a long term if your funding runs out and you're not able to, to renew it or get alternative funding. So that's definitely a challenge, or at least I found in my case was a challenge in this particular project.
Mm-hmm. Yeah, so can you talk about how, just want to stay with you just for a quick second, because I think your narrative of how you kept your project going.
So we by the advice of Michael Braverman, who is no longer officially there, we have now a partnership with the Department of Planning. And so what we were able to accomplish is to, using some of the results of this pilot project, submit a big proposal to the National Science Foundation, which involves, more partners, community partners as well. Hopefully we get funded, I don't know. But I mean, the results of this study, which is hopefully will be wrapped up by the end of summer, we'll be able to report to Chris Breyer, who is the head of the Department of Planning, and they're very much interested in what we find out.
And as we wrap up our panel, I'm going to ask each panelist really quickly to share any advice you give someone who is looking to work on a type of project like yours. So we'll start with you, Kelly.
Sure. So I would just say that, the relationship between Hopkins and community, we know, has both positive and some challenging aspects. And I think one of the things we do as individual faculty and students at Hopkins is we show up, we build personal relationships with individuals and organizations, and we listen, and we really center and lift up the work that the organizations and the partners who we are working with see as valuable and see as important and see as the priority.
And Stacey, advice.
So I would just say to just really build on and maximize your relationships. And also, if there's cross collaboration between different types of entities, I think that just makes you very, very strong. The health department, one of the reasons why we have so many partners engaged in Be More for Healthy Babies is because there are certain limitations that we have administratively, bureaucratically, but also there's just a whole lot of strength in different types of perspectives. So we have just been so grateful to be able to have strong partnerships with Hopkins, with Family League, and with the other organizations that are part of our leadership team, who have just made the community a priority and been able to sustain our initiative. So just think about sustainability and think about the diversity that you can have through different partners. That would be my advice.
And Kathy.
Yeah, so the most important words have been said many times. I think it's respect, trust, listening. I think the recognizing the fact that we might come from different universes, but we have to work, but we have to find this common ground and recognize that what we do together is mutually beneficial. We all get something out of it.
Amen.
I love it. I think that, we have a great recap of, partnerships and community and finding common ground. And I think that's sort of the narrative of what we're all trying to do. I'm going to turn it back over to Dr. Purnell.
Thank you so much, Dr. Jones, and hand claps all around for our dynamic panel discussion number 2. And so I may be a little bit biased, but I think that both of these panel discussions were amazing and really helped to shine light on many of the key important and key components of trying to do this work the right way. And so at this time, I welcome you all to continue to submit any questions that you have in the Q&A or even in the chat. And I'm sorry, I noticed after the fact that several of you indicated that the chat was disabled when I asked for your wonderful comments about the video, but I did see that several of you did, share that you thought that the video was amazing, and I agree. And so I also at this time just wanted to acknowledge some other folks who are in the audience. And so we have people who are long-term UHI members and or collaborators and partners. So I see Amy Gawad, I saw Mindy Levin, Crystal Evans, I saw Kiala Jock, I saw Michelle Spencer with the Bloomberg Initiative, and so many others. And so thank you all for always being so supportive of the work and the mission of UHI. And so I do have a question from Dr. Londette Jones. So I invite our faith-based panel members, if you are here and able to turn your cameras back on, well, all of the panelists. So the first question for the 2 faith-based partnerships, have any of you attempted to leverage this important work towards other future funding mechanisms? Often academic type funding require huge amounts of preliminary data and or evidence of long-term outcomes. And so just wanted to know about advice or plans to scale up the work. And so Dr. Greer, Pastor Prentice, perhaps we can start with both of you, just your thoughts about any future plans.
Yes, so do you want to start, Pastor Prentice?
No, just go ahead. I mean, I think it's evident because of what we said earlier, how we did the pre-diabetes program. Now we're doing Drive, and we just know that God is going to blow it up more for us to do a whole lot more. Because as a community have needs, we see those needs, and so we're going to be trying to go after more.
Yes, and we were for, we did it with the Urban Health Institute grant. We were able to implement a cohort of patients in the DECIDE program, and with much success. And so they had improved diabetes outcomes. And so based on that initial pilot work, we were able to secure additional funding from the ABLE Foundation to continue to implement programs at Zion Baptist Church, as well as Memorial Baptist and Israel Baptist, and we hope to keep going. So we're really excited about that. And other people within at the Bronchitis Center have also worked to leverage a lot of the work that we've done with Zion Baptist Church with the diabetes prevention program to launch their K Awards and things like that. So it has been a platform that where we've created to build even more partnerships and more work to really improve the health of the community in a number of different ways.
So let me just say also thank you.
Oh, yes. And, and on behalf of our COVID-19 project, I can just say that we're actually in the middle of doing that work right now. It's ongoing. But as Pastor Mike and Pastor Phil know, I've already started talking about what's going to be next. I know that I believe they might block me on their caller ID if that's still a thing. But one of the things that, as they alluded to earlier, that unfolded as a part of this survey is the vast needs of the members, and they go beyond COVID-19. Yes, that's the topic of the day, but food insecurity, housing insecurity, and other chronic illnesses, etc. Those things are also still there, and we are also continuing to look for additional ways to provide all of the resources in a holistic way that really speaks to the needs of the members, including our resource guide, which we are actively building. We're up to, I think, about 30 pages of resources for members based upon some of the needs so far. And I've told them, we're gonna pull you into some of these transplant grants and everything else because, again, these are our whole individuals. And so I'll let them talk about whether or not they already decided to block my phone number or not. But
No, as I stated earlier, this is just the foundation. There's a saying that I love to hear, and it's a Chinese proverb. And it says this: we plant a tree in this generation that the next generation may have shade. And that's the whole objective of, that we're looking forward. That, as we plant the seed for now, COVID is just the beginning. Who knows what may go into, as we said earlier, with the expertise that Dr. Purnell had can take us to unlimited places. And I just want to share this. We didn't get to share it earlier. One of the things that we marveled at as far as with the COVID, we've had the opportunity to do an interview with Bloomberg News. They did an interview with a couple of members of the church, but my wife and I, last week, we went to get our COVID shot. And what they did, Bloomberg sent a photographer with us that went through the whole process when we were over at Northwest Hospital to get our shots. They took our pictures from time we got there to time we left, and then the young lady took the information and they're doing another article, which again gives us a broader scope to what's going on with this COVID. So we just see this as a beginning. We're just how you say that, just skimming the surface.
Yeah. Yes, and if I must say just for a second that we, out of this interview, we've just been sitting here talking. We've just gotten excited about what's taking place. Of course, this is our first time here, but we're excited about what's taking place, about what God is going to do and how this is going to spread. I just believe God that it's going to spread into the communities and it's going to meet needs for people who are just, some people won't say anything outwardly and they're hurt inwardly, but if they're given the opportunity to write it down, like the survey that we're doing, they will share it in that survey. And so part of the survey is picking up some of those things that are not things that are not just so spoken outwardly in the survey. So it's been good and we're excited here. We've already started thinking about some other things. So we're grateful for the opportunity. Thank you, Dr. Purnell.
And you all heard it here first. So, as we continue to try our efforts to land on the moon, you heard it here first that they're excited to continue on this journey. So thank you all. And even to panel two, thoughts about ways that this work has continued or will continue even beyond the initial grant. I know that several of you have already shared how some of this work has led to other grants and other initiatives within partnering agencies, but any additional thoughts about that? I'm looking at you, Stacy. Oh, Kelly.
I do think, really building on what you already said, Tangela and Pastor Addison, I think the longer you work in partnership and in community and in relationship with your partner, the more you get to know the needs of the community. And then as a faculty person, what that allows me to do is, as I see funding mechanisms and opportunities, my mind immediately goes to those needs that, again, maybe we couldn't address in the first grant, but perhaps there's now an opportunity because of this funding mechanism to address that need in a future grant. So, you know, Stacy and I are meeting this week later to talk about an NHLBI grant that we're going to think about applying for, to look at maternal cardiovascular health through home visiting. So I think that those relationships, just the deeper they are and the more robust and the more you really understand one another, the more productive they become in terms of future funding and projects.
And I'd also like to interject that the health department also loves working with faith-based partners as well. And Be More for Healthy Babies in particular, I just put this in the chat, does have a faith-based initiative. And there's a monthly convening of that working group that Pastor Meldon Dickens oversees for us. So we are always inviting new churches to join in, and it does go beyond Christian churches. You know, we invite mosques and we invite the Jewish community to join in as well. But just know that, you know, when we all come together, faith-based institutions, academic institutions, and the government, oh, what we can accomplish.
I love that. I think that is a great way to end our formal Q&A, other than saying, Stacy, can we get that email with the information for this funding mechanism? I would also like to thank Ms. Rhonda Chapman, who also shared an initiative from the American Heart Association of Maryland, which also has an initiative around faith-based partnerships as well. And she asked us to share that with everyone attending. And so, so we will be sure to share any additional opportunities that anyone shares with us, including those of you in the audience. And then just finally, I will read off some of the really nice comments that people have sent in. The first one: may God continue to bless you all and your teamwork to help your communities. We have another one saying, thank you for your wonderful work in our communities. And then finally, thanks to all of the panelists for sharing your partnerships with us. This is such important work. And so with that, I will say amen again. And I invite Imani to tell us about our UHI Community Voices series.
Thank you, Dr. Purnell, and thank you, panelists. Okay, so I think the slide is up. So the UHI Community Voices series was launched in December 2020. And the initiative began because we work with amazing community organizations, organizers, and leaders, as you've seen a small portion of some of those leaders today. And we just realized how amazing their stories are, and that we really wanted them to tell their stories. And so we launched this initiative to feature them monthly. And we usually feature people that have interacted with our programs, whether it's our funding initiatives or our Bunting Neighborhood Leadership Program or our Community University Coordinating Council. And if you can hit the next slide, Natalie. And you can find these stories on our community partnerships page, which is on the homepage of the UHI website. And if you are someone who has been a part of our funding opportunities or has partnered with us on one of our programs, I invite you to be featured. You can contact me directly at the moment. My email is iwest@jhu.edu, or visit the website on the screen. And in the future, we'll be working on a form for people to submit their stories. But right now, I'll be doing the interviews personally. So yeah, thank you for letting me share.
All right, well, I think that we are actually sticking to our time. The final thing is I will make my final remarks by just reminding you all that we did record today's event, and it will be shared on our website and our YouTube page, as well as in a follow-up email to all of the people who registered. And we have a couple of additional events that are coming up that Kelly and I are leading. For example, our grant writing workshop, which will be offered on April the 28th. We also have a request for proposals for the Baltimore Health Equity Impact Grant and our strategic consultation grants. And so again, two of the funding mechanisms which were highlighted today. So this opportunity will be released on April the 19th and proposals will be due on June the 7th. And then our longstanding social determinants of health symposium, which the planning is being led by Dr. Rachel Thornton and Dr. Kendrick Gwynn. And so this event will be held virtually this year over a series of days, May 4th through 7th. So a couple of hours each day. And we look forward to the exciting content that will be shared during that symposium. And so I, just wanted to, and I apologize, you may hear my dog barking. I wanted to end with the comment that Judy shared in the chat. Thank you so much to all of the panelists. I'll say to all of the participants of today's program. Your stories and journeys are so inspiring. The impact you are having is absolutely incredible. Thank you for restoring faith in humanity. I think that is perhaps a wonderful way for us to close. Thank you all who stuck with us to the end. For the record, we ended on time. And again, thank you to all of our program participants, as well as to all of the team members who are working so diligently in the background, especially you, Natalie. So stay well, and we will see you all in a different mechanism. Goodbye.